is our pathology project on orthostatic hypotension. The definition of orthostatic hypotension is a decrease in 20 millimeters of mercury or greater in systolic blood pressure, or a decrease in 10 millimeters of mercury or more in systolic and diastolic arterial pressure, with an increased pulse of 15 beats per minute when changing of position. The pathogenesis of orthostatic hypotension is based off of position, and it is based off of the venous pooling in the lower extremities. What can occur is you have a decrease in fluid volume, or you have ANS failure. And underneath these two you can see what types each of these are. There can be acute, temporary, or chronic types of orthostatic hypotension, and the highest incidence is in older adults, with half of frail adults having this condition, and it contributes to morbidity, syncope, falls, and vital organ ischemia. The signs and symptoms of this condition are lightheadedness, dizziness, syncope, and headaches.
Okay, for our draw to know it part of the equation here, we have a great drawing of the body with the brain up top and the heart down at the bottom. And the top drawing, you can see the body laying supine with the brain being perfused with blood. Then you move down the chain and you move to upright, and then if you move to that to the left side of the flow chart, that's the normal function of the body that should happen. There should be an increase in blood pressure in order to keep the brain perfused. If you move to the right, those are the pathologic states, and there are 3 different pathologic states that can end up causing loss of consciousness, dizziness, lightheadedness, or headache. And the first is a pump failure. As you'll see in that first diagram, the heart can't keep up with the demand and can't perfuse the brain. The second is one of our main pathologic considerations. That's the loss of fluid or dehydration. So there's not enough fluid to get up to the brain. And the last is a tank failure. So that's the ANS failure. So there's not enough sympathetic innervation to constrict the blood vessels to keep the brain perfused. And this relates to our top 20 in our blood pressure regulation. And there are 3, you'll see in there are 3 different components with the pump, the fluid, and the tank all involved. And that is it.